be good. So we're going to talk about GTL, who we are. We're going to talk a little bit about goals, the need for short-term home health care insurance, product features and benefits, setting an appointment, the important processing information, and at the end I will share with you an alternative three-choice close. That's about here at GTL. So this right here you will see popping up on the screen and momentarily. This is a picture of our building in Glenview, Illinois, which is a suburb of Chicago. We have been in business since 1936. We're a mutual company, so technically we are owned by our policyholders. Gives us the ability to act much quicker than, say, a publicly traded company. We are licensed in 49 states, all states but New York. 8-year history of take care of your clients. From your client's viewpoint, in fact, we've been in business over 80 years and important. We've got a top-tier rating with AM Best, zero debt. Talk about our plan, short-term home health care insurance. These are the states that we are currently approved and doing business in. We're almost at 50%. And in the supplemental business for many, many years, we are experts at it. We know what we're doing. And what we do is we provide your clients plans so that they can collect on them. In the last 2 years, we have paid out over $80 million to your clients between our cancer, heart, and stroke plan and our hospital indemnity plan. We're very proud of that number because what that number says is that our plans get used, and when an insurance plan gets used, the clients are happy with you that you brought it up to them. And when they're happy with you and they're happy with the plan, guess what? They keep it for a long time, and so you continue to get paid your residuals and getting referrals from the client. About goals. Now, we all know about goals and the importance of them, but every once in a while we need to be reminded of, that, hey, we need to stay focused and pay attention to our goals. So a goal should be in writing, believable, achievable, measurable, have a deadline, and you need to commit to reading your goal every single day. So why put in writing? There's something magical that happens when a pen strikes paper and you write down your goals. Goals believable. We all know that if we believe in something, we can achieve it. Make goals measurable. Sometimes I'll say to an agent, hey, what's your goal for this year? And the agent will say, I want to have a good year. Okay, excellent. But what does that mean? What would constitute a good year? Let's get something that we can measure. Oh, a good year would be if I could, increase my premiums by 25%, or if I could increase my income by another $40,000, so on and so forth. Great. Now we have a goal that we can measure. It's very important also to have a deadline for that goal. Most importantly about your goals, commit to reading your goals every single day because that will keep you focused on them. And in life, what we focus on is what we achieve. Here's a real simple technique that I use. At the end of the day, before I leave my office, I'll grab a sheet of paper and I will write down my short-term goals that I want to accomplish tomorrow. Put that on my desk. Tomorrow, when I come in, very first thing that I will look at is my list of the goals that I want to accomplish today. And then I have a set of goals for a month, 6 months, a year, and 5 years. So big difference to write them down and not just to think about them. You guys all know that, but sometimes we just need to be reminded of it, so we start practicing that. Why GTL short-term home health care insurance? Most Americans would prefer to recuperate at home. And is that, why don't they want to go to a nursing home? We all know the reason is people feel that they go into a nursing home, they're not going to get out of it, and that's where they're going to end up. So that's where our plan comes into play. Benefits are paid directly to the policyholder regardless of any other insurance that they have. Benefits can help cover deductibles and co-payments of other health insurance. No hospital stay is required to start collecting on your home health care benefits. You can combine your home health care benefits with coverage for hospital stays and accidents to complete your coverage. So let's for a minute about what does Medicare cover. So Medicare will cover skilled nursing on a part-time or intermittent basis. It will cover home health aid services on a part-time or intermittent basis if needed as support services for skilled care. It will cover physical therapy, occupational therapy, and speech-language pathology services. Medical social services advised by doctor for emotional and social concerns relating to illness. Medicare doesn't cover. All right, 24-hour-a-day care at home, not covered. Meals delivered to the home, not covered. Homemade services and like shopping and cleaning and laundry services when they aren't related to your plan of care, not covered. Care by home health aides like bathing, dressing, and using the bathroom when the only care needed, not covered. Technical situation here. All right, we got that handled. So when you combine the industry-leading home health care benefits and riders of our plan, which we'll cover in a moment, along with our administrative and policy issue capabilities, plus the Ask Mayo Clinic, fourth leg of our plan, it is an absolute win for GTL's policyholders, agents, and distributors. So the base plan, there are 4 parts to the base plan, and choose A, B, or C for the level of coverage. Issue age is from age 40 to 85, and it's unisex rate for the plans. Let's look at 3 of the 4 legs. The 4th leg of this plan is the Ask Mayo Clinic access so that your clients can call into the Mayo Clinic about anything that has to do with a situation. So 3 other legs to the plan: healthcare benefits, the professional services, healthcare aid benefit, and prescription drug. So you will choose either coverage A, level A, B, or C. When you pick a level, that's the level that you have for all 3 legs of the plan. For instance, plan A here, you see at the bottom, it says that the combined daily benefit for Plan A is $150. So we can collect $150 per day for up to 360 days for these services here. Plan B allows us $300 per day, and Plan C allows us up to $450, and we pay in these increments. For the home health care aid benefit, Plan A will allow us $40 per day, Plan B, $80 per day, Plan C, $120 per day. And remember, once you use a plan, we have that plan for all 3 sections. Prescription drug benefit plan, we pay for Plan A up to $300 per year, and Plan B and C up to $600 per year, and we will pay $10 for every generic prescription and $25 for every name brand prescription. So let's talk about, to qualify for the benefits, a licensed healthcare practitioner must certify you as having cognitive impairment in the brain or functional impairment, and that is the inability to perform at least 2 of the 6 activities of daily living without substantial assistance. The minimum benefit period for short-term home health care is 360 days. Benefits restore once the benefits have not been paid or required for 180 consecutive days. Remember, like $150 per day for Plan A, which could be up to $54,000 in benefits. Plan B, $3 per day, which could be up to $108,000 in benefits before it restores after 180 days. And Plan C, up to $450 per day, up to $162,000 in benefits. So let's do an example. This is a 65-year-old who has Plan A. They for a stroke. They in and they have done in their house, in their home, 10 speech pathology treatments and 10 therapy treatments over a 10-day period. So they're going to get paid $5 for speech pathology treatment times 10, $750, and they're going to get paid $75 for each physical therapy treatment times 10, $750. Combine the two. In this instance, they're going to be paid $1,500. The premium for this plan, for 65-year-old, Plan A, is $294. So see already huge benefit to clients when they need this plan. Hopefully they will never need to collect on this plan other than prescription drug. But we do, we're there for them. Go over some of the short-term home health care benefit terminology. So skilled nursing care, that's an RN, provided by a registered nurse. General nursing care, LVN, that is care provided by a licensed practical nurse, LPN, or a licensed vocational nurse, LVN. Physical therapy, to help the patient